औज़ुबिल्लाहिमिनश्शैतानिर्रजीम बिस्मिल्लाहिर्रहमानिर्रहीम। रिस्पेक्टेड सुनने वाले, जैसे कि आप लोगों को मालूम है कि आप लोगों की रहनुमाई के लिए मैंने एक वीडियोस का सिलसिला शुरू किया है, शॉर्ट वीडियोस। और इस सिलसिले में आज का टॉपिक है जो कि एक इंतहाई अहम टॉपिक, वो है सेरेब्रल पॉलिसी। सेरेब्रल पॉलिसी आपको शॉर्ट केस में आ सकता है। टॉपिक शुरू करने से पहले एक अच्छी बात कि समटाइम्स समथिंग सीम्स वेरी हार्ड, sometimes impossible, but remember, keep going and you will make it. So this is the thing। एक अच्छी बात के साथ हमने स्टार्ट किया। देन आपको कमांड क्या आ सकती है? आपको कमांड आ सकती है डू जी पी एंड रेलिवेंट, और द चाइल्ड इज अनेबल टू वॉक, डू जी पी एंड रेलिवेंट। और आपको लोअर लिम्ब एग्जामिनेशन की भी कमांड आ सकती है, एग्जामिन द लोअर लिम्स एंड relevant. So whatever the command, you have to proceed accordingly. Before the starting, make a general look that the child is developmentally delayed or having a cerebral palsy or not. So before jumping on, you have a general look. The sequence, this depends on the command. If the command is do GP and relevant, then you start with the introduction, consent, exposure, hand sanitizations, the normal steps for all short cases. Then you have to do the journal look, and you may appreciate that the child is sick or well looking, cyanosis or respiratory distress at rest, pallor or jaundice. What about the nutritional status? Is there any diagnostic or dysmorphic features? Then start from the hands, okay? So if this is a GPE, you can immediately put the thermometers while you put on a hand, and you just hand, you take the hand, thermometer will be in the armpit, you check for clubbing, koilonychia, leukonychia, then go to the palm, check the palmar erythema, dryness, cold for hypothyroid. And when you are in the wrist, check the pulse for rate, rhythm, volume. And in the same time, you check the respiratory rate. Check pulse in 6 seconds and multiply it with 10, and respiratory rate at least in 10 seconds and multiply it with 6. Then you go to the elbow for epitrochial lymph nodes, then arms, right arm for the BCG scar, then go to the head. Then see the shape, check size, FOC, fontanelle, check the hairs, touch for the temperature. We have already taken temperature. Then check the eyes for cataract. It can be due to torch, pallor, jaundice, position of the eyeballs. This will check the third, fourth, and sixth cranial nerves. Then you go and check nose and ears, then mouth. Then you check open mouth. It will check the fourth, fifth cranial nerve. You make the child small to see the seventh cranial nerve grossly. It is about grossly. Then make the child do ah sound, and you check the 9 and 10 cranial nerve. Then tongue out to check the 12 cranial nerve. Then you check the neck and axilla for the lymphatic system and any palpable lymph nodes. Then you see the chest for apex beat, palpate for tracheal position, auscultate for heart sounds and breath sounds. Okay, there can be aspiration pneumonia, there can be associated congenital heart diseases. Then you check the abdomen for hepatosplenomegaly and heart pseudo perforation, because they are frequent suffer from constipations. And then see the genitalia, and whether the child is in the diapers or not, because they have not been they have not achieved, they may not have achieved this control of the urinary stool. Then check the legs for the edema. Then check the motor system of the child. First see the position of the child, tone, bulk, power, reflexes, plantars and superficial reflexes. Then perform developmental assessment. Pull to sit, you have to see the head lag, the arms under axilla for scissoring. When you are pulling the child, you must put one hand and don't pull from the elbows, okay, from the wrist. Okay, hold it respectfully and carefully. Then parachute reflex, and then put the child in a prone position, and check the back arching and see bed sores. Then see back of the legs for tender release scars. Then gait. Ask if the child is able to walk, then make him walk to see for limp, DDH and hemiplegic gait. Then height and weight. If the child is not able to walk, then it's not possible. Then complete the examination by saying that I want to take blood pressure and plot height, weight on centile charts. If command is on the motor system and relevant, then you, after general inspection, you make that the child is having cerebral palsy. Then ask if the child is able to walk or not. If the child is able to walk, then start with the gait including cover signs, motor system of lower limbs, then from hands to toes as mentioned before. So that differential diagnosis most common is the cerebral palsy, degenerating brain disorder, and post-meningitic sequelae. The description hypothetical which I have made is I have examined a 3-year-old microcephalic child with no dysmorphism or any abnormal movements. He has increased tone, reflexes are brisk in all limbs. Power is 3 by 5 with outgoing plantars and ankle clonus is present. The superficial reflexes are absent and primitive reflexes are elicited. Gait could not be assessed as the child is unable to walk. Accessible cranial nerves are intact. Hearing, speech, and vision seem to be impaired, though I want to perform formal audiological. So the developmental age of the child is 6 months. Eye, CVS, and abdominal examination is normal. So the investigations you before telling the investigation, you tell the examiner that I want to advise some investigation for the diagnostic purposes and some for the supportive purposes. The diagnostic investigations are CT or MRI brain, metabolic screening for ruling degenerative brain disorder, and karyotyping and TOS screening. And the treatment you have to say that my aim of is management is to ensure the optimal growth and development of the child by controlling the disease and treating and preventing its complications, the immediate goal. So the multidisciplinary approach, it consists of the pediatrician because of the recurrent upper respiratory and urinary tract infection, and then physiotherapy is a very important aspect of the treatment because there may be spasticity. For that, baclofen, botulism, tunneling is given. Speech therapy is required. Occupational therapy is required. Hearing aids are required. Orthopedic surgeons are required for contractures and tendon. And nutritionist is required. So remember, when you have given a case of cerebral palsy, it will give you a clue that it's a general physical examination. So you must do the general physical examination, including vitals, that is height, weight, FOC, compulsory. Then you do the relevant. Don't miss the command which has been given to you. If there is cerebral palsy, you should try to focus at cerebral palsy, and if it possible, you just make it out what type of cerebral palsy is this. So this is basically a random approach. You can I have just given you uh, about just general description. You can make it out, but the main important thing you can reach to the differences or a working diagnosis. And I thank you for your listening. And you can also I'm trying. I have a plan of starting a WhatsApp group for basis of any questions or any queries. You can SMS in that. You can WhatsApp on that group. And I finish by praying that may Allah be our protector, our helper, and our guide. Best wishes for all of you, and be good. Keep on spreading the good. Allah Hafiz.